Good morning everyone. In today's video we are going to cover the basics of endometriosis, including what is it, who gets it, as well as the symptom, diagnosis and treatment of endometriosis syndrome. Whether you are looking an answer for yourself or someone you love, I am here to give you the best information available. So let's begin with its meaning first. What it is. How do I know I have endometriosis? According to doctor, endometriosis affects woman body every month when they get periods. And every month these cells react the womb lining, building up and then breaking away, and every month woman has to face certain type of problems like gastrointestinal or constipation problems, weakness, awakening at nights, don't desires to eat, prolonged labor, no routines in meal timings, heavy bleeding, dizziness, and abdominal pain. What are the underlying symptoms of endometriosis syndrome? There are certain symptoms of endometriosis. These are like acute pain in lower abdomen or back pain during periods or non-period stay, heavy periods, frequent periods or even early periods also, bleeding in between periods sometimes spotted or sometimes heavy, passing clots during a period's time, painful urination, painful defecation, infertility, as well as depression. ASRM, American Society for Reproductive Measures, classified this system of endometriosis into four stages according to the number of lesions and the depth of infiltration. First is minimal, stage 1, mild, stage 2, moderate, stage 3, severe, stage 4. Click on the detailed information about the certain stages in endometriosis. Stage 1 or peritoneal endometriosis. This is the most minimal form of endometriosis in which the peritoneum, the membrane that lines the abdomen, is infiltrated with the endometriosis tissue. Stage 2 or ovarian endometriomas. It is a form of endometriosis that already established within the ovaries. These form of endometriosis may cause ovarian cysts and are particular concern due to their risk of breaking and spreading endometriosis tissues within the pelvic cavity. Stage 3 or deep infiltrating endometriosis first. This is the first form of endometriosis that involves organ within the pelvic cavity. This can include the ovaries, rectum, uterus, and can significantly distort the anatomy of the pelvic organs also. Stage 4 of deep infiltrating endometriosis. The other more extreme form of endometriosis is stage 4 because it also involves organs both within and outside the pelvic cavity. This includes the bowels, appendix, diaphragm, heart, and lungs, among others. What are the certain effects on pregnancy? In general, when women are young, less than 35-year-old, then it is reasonable to remove any visible endometriosis from the pelvic region. But if women are 35 or older than that, then other fertility treatments are recommended by the doctor instead of laparoscopy, especially in stage 1 and stage 2. If stage 3 or 4 endometriosis is present, then infertility rate mostly get higher after surgery performation. If pregnancy does not occur within 6 months after surgical treatment of endometriosis, then other fertility treatment should be discussed by the gynecologist. Unfortunately, some women with endometriosis can have a cyst that can come back again and again. And if cysts are removed over at a regular interval of time, this can cause a loss of eggs from the ovaries and can make it harder to become pregnant. Endometriosis is most commonly grown in the following areas like ovaries, fallopian tubes, ureters, bowels of bladder, abdominal walls, and their different appearance, shapes, or color. However, none of the existing hypotheses have been completely proven, and many mechanisms still remain unclear. It is possible that different mechanism accounts for different presentation of endometriosis. Endometriosis and infertility. Endometriosis has been associated with infertility factors because it affects gametes, embryos, fallopian tubes, and the embryo transport system. Women with mild endometriosis have been shown to have a significantly lower probability of pregnancy over 3 years than a woman with unexplained fertility, 36% vs 55% respectively. IVF studies have suggested that women with more advanced endometriosis have a poor ovarian reserve, low oocytes and embryo quality, and poor implantations. Sperm quality or function even is also decreased and has been proposed to be from the inflammatory toxic effects of the peritoneal fluids and increased activated macrophages. The increased number of inflammatory cells in the peritoneal fluid not only damage the oocytes and sperm but have also been shown to have a toxic effects on the embryos. How to diagnose endometriosis? There is no lab test or procedure to diagnose the endometriosis without surgery. But some imaging studies are there to examine the common symptoms of endometriosis, and these are ultrasound and MRI. Retrograde menstruation theory is the most accepted theory where endometrial tissues and cells enter the abdominal cavity through the fallopian tubes at the time of the menstrual period. Studies have also demonstrated that endometriosis caused by over and underexpression of biochemical factors, genetic factors, external factors. These factors cause rapidly spreading of endometrial tissues attached to the abdominal walls of the pelvic region and invasion into the deepest layers by forming blood vessels for growth. Increasing evidences suggest that an impaired immune system and inflammation also play a central role in these processes. Dealing with endometriosis, its pain, complication, and fertility problem can be hard to cope up with and can become very stressful for a woman. So, consider joining a support team, and it's better to take a help from the gynecologist. So, this is all for today's video on a woman healthcare. If you like it, please go and subscribe my channel. I will be coming back with lots of information on a certain topic. Till that, bye bye, take care.